The basic goal of this study was to compare an 8 megapixel display to two side-by-side 5 megapixel displays for use in diagnostic imaging, essentially mammography. And we measured two different things in this study. We measured diagnostic accuracy, and this was done with an ROC study where the essential task of the readers was to look at the images and decide if a lesion was present or not. Then they had to indicate if it was a mass or a microcalcification or architectural distortion or both. And then they had to rate their confidence in that decision, and that's where we get the data for the ROC analysis. We also measured efficiency of reading. So we measured total viewing time per case as well as whether they had to zoom and pan around the images and how often they had to do that on both the 5 and the 8 megapixel displays. What we found was that with the 8 megapixel display, it was about 7 seconds on average shorter to view the set of images when they were displayed. And that was across all the readers, and it was statistically significant. And essentially what we think happened was that not having the bezel or not having to deal with two different displays, perhaps at slightly different angles, having to move across two pieces of territory in a sense, facilitated the examination of the images. And with the 5 megapixel displays, they were going back and forth literally as if it was two different objects. Whereas with the 8 megapixel, they just did a smooth transition between the two images. And perhaps what that reflects is that with the 8 megapixel display, they can take in more information because, again, the images are literally touching. Having that physical barrier of the bezel going down between the two images translates into something that your eyes have to traverse across. And even though you can convince yourself that it's not there, that it doesn't matter, the eyes are attracted to it. And the visual system is all based on how much information can you take in with your foveal or your central high-resolution vision as well as your peripheral vision. And the more you move the images farther apart from each other, the less a person can take in a single glance. So having the images side by side literally makes it easier for the visual and the cognitive system of the radiologist to take in more information. On top of that, we found that there was really no statistically significant difference in the amount of zooming and panning that they were doing. In other words, even though the 8 megapixel displays were showing the images at slightly lower resolution, they did not have to zoom and pan more with that compared to the two 5 megapixel displays to detect the lesions and decide what they were. In these days of increased pressure on radiologists to read more images, to get through more cases in a day, and just an increase in the volume of patients, hopefully with awareness of having to have a breast screening done, you need to save as much time as you can when you can. And if it takes less time to view the images, but render the same diagnostic decision, that certainly is an advantage. And the less time you spend having to zoom and pan, that's a savings as well.